So I think at this point we'll just start our discussion. This session is also being recorded, so those people who are not able to join us at this moment can also have a rendition of the same information. They might just only miss out on the interactive session of the discussion. So today we are going to be discussing premarital test and premarital counseling. We are going to follow this outline in our discussion. First off, we'll just give some general introduction of what premarital tests actually are, and we'll be looking at what to look for those people that will be getting married, and then also for all of us in this meeting to be aware of and to share the information. What are we to look out for in terms of premarital tests and counseling, and then how do we take this test and where do we take this test? The last part of our discussion will just be a summary of all we have been saying, and also we'll leave some room for some discussions as well as some questions and some interactive session. All right. Before we continue, I would say this episode is primarily powered by Deso Medical, and right now we are a medical institution set up to give holistic healthcare intervention to people in our immediate and even our distal environment. We have avenues for online counseling. We are the medical center currently where we manage patients and we give clinical services. Okay, so now why are we discussing this subject of premarital testing today? And let me just say, like, maybe if we have an idea of the disease burden, then we'll be able to know exactly why this is important. Now, as a medical student about 8 years ago, the first time I ever went to a pediatric ward, I met this 9-year-old boy, a very handsome, very brilliant young boy. He was with his mom in the ward right there. And in the process of, as a medical student, just finding my way around the ward, the boy was outstanding because he repeatedly complained of how much pain he was in. And I can remember very clearly because he was repeatedly saying, "Mommy, my back, mommy, my head, mommy, my leg." And at some point he said, "Mommy, everywhere is paining me." And as a young medical student at the time, I was really distressed. And when I asked my senior colleagues why the child is such in pain, and they said the child is a sickler who is currently having a vaso-occlusive crisis, as we'll call it. And at that moment, I became one of the staunch advocates of sickle cell awareness. Currently in the world today, Nigeria hosts the burden of the country with the highest amount of sicklers and even the highest amount of people with sickle cell traits. Our current statistics, a recent statistic is that about 150,000 children are born every year in Nigeria, and with this, about 25 to 30% of them actually are carriers of the sickle cell trait. Now, having this idea of the disease burden begins to remind us of exactly where we are and why this is important. Now, to push the point home a little, 25 to 30% of the adult population in Nigeria are carriers of the sickle cell trait. This means 1 in 4 people you see likely have the sickle cell trait. By the time you are aware of this, then it begins to inform you, and then it begins to make you aware of exactly why this premarital testing is important. Now, the young boy I was talking about a few minutes ago, the family were always in and out of the hospital. They were always in and out of the hospital. The financial burden of healthcare for these children, the school burden, and then it creates a lot of marital tension and a lot of marital strain. There have been marriages that actually got broken up because of health issues. So the magnitude of this premarital testing cannot be underemphasized, especially in light of the particular society where we live in. Also, it affects the quality of life of the life of the couple, the life of the children who will be offsprings of that particular marriage, and And then also it has a burden on the immediate society, the family, the friends of this index family, who, for example, have a disease that potentially would have been prevented with premarital screening and premarital testing. So we're going to be moving on now. What are the diseases to look out for? When we do this screening, this test, what do we actually look out for? Now, this is by no means an extensive list of all the tests or all the diseases we should look out for, but these are the most important ones. Most important because they are the most common. Most important as well because they are actually the core of the burden when it comes to diseases that have a very strong strain, a heavy strain on families and couples around us. The first we're going to be looking at is sickle cell. There's a lot of campaign and sickle cell awareness. Just last month we had the sickle cell day, and at Deso Medical here we did quite some campaign just to make people aware exactly of what this is. Now, sickle cell, and this might be a little bit technical to some of our audience, but sickle cell is a hereditary condition. A hereditary condition that this means that it is passed from parents to offspring. Now, the reason why it has perpetuated so much in our society is because carriers of the traits, people that have the traits might not manifest it. And because of this, they might go around really not knowing that they are carriers of the traits. But by the time two carriers of the sickle cell traits get married and begin to have children, they have a 1 in 4 chance of having sickle cell children. A 1 in 4 chance for every child. You know, people misunderstand this statistic a lot. They think, so if they have 4 children, one of them is going to be a sickler. No, that is a wrong estimation of the risk. It means for every child that you're going to have, the chance of that child being a sickler is 1 in 4. So if you have 10 children, you have a 1 in 4 chance for every child you have being a sickler. Now, when we talk about being a sickler, you know, it's easy to misunderstand this condition. Truly, with care, with proper care, the disease condition can be managed. But I can also tell you that if you interact with the parents, because this is what we do almost every day, we get to see, especially for people who work with children, who clinically work in a setting where they actually work with children. There's almost no day that goes by without you having a tickler who has a particular condition. Either they're having a bone pain or chest pain or headache or something. And the more they have, the more they suffer from this, the more the impact to the quality of life, which we were talking about earlier, the more the strain on the family. So a 1 in 4 chance of each of their children being sicklers. So this is actually a heavy burden to consider. In our part of the world, the sickle cell becomes the most common of this hereditary condition that can be forestalled if premarital testing is carried out. When we do premarital tests for sickle cell, we check for the hemoglobin genotype, and we've heard severally that people who are genotype AS or genotype AC are carriers of the trait. We discourage marriages between carriers of the trait. The reason why is what I've highlighted earlier, the 1 in 4 chance for each of their babies possibly being carriers of the trait, or being sicklers, when 2 carriers of this trait are married. The next condition we're going to be talking about are viral diseases. I lumped them into viral diseases, but I'm going to highlight 3 of them: HIV, hepatitis C virus disease, and then hepatitis B viral disease. Now, I mean, there is so much. I think the most popular disease, probably second to COVID in the world currently, will probably be HIV, because of everybody knows it is incurable. Today, with today's medicine, HIV can be managed significantly, such that the quality of the life of the individual is significantly improved, as well as the length of the life of the individual being significantly improved. However, it is important to know this: when you're getting married, when a couple is preparing for marriage, it's important that they are aware of their HIV status. Most philosophical as well as religious institutions actually enforce this. And legally, this is actually what's one of the legal impediments to marriage. If you, for example, in a way, doctor the results and make your spouse not to be aware that you are actually living with HIV, this can be one of the reasons why they can actually terminate the marriage. So it's important that the viral status for both of the individuals be known to them. So HIV is one of them. Hepatitis B and C are also important viral diseases that we should screen for when a couple is intending for marriage. Now, the impact of the viral diseases to life is, okay, for example, HIV. In today's medicine, there is no cure. There's no cure for HIV. There are many improvements, improved medication, improved quality of life, and all that. However, as it stands in today's medicine, there is no cure to HIV as an entity. Now, for hepatitis B and C, managed properly over a long period of time, they've been, with new breakthrough in medication and pharmaceuticals, there have been recorded cures of this disease. However, that is not the point. The point is the spouse must be aware of their viral status. The reason why is because by the time the couple is married, through exchange of bodily fluid, from living together, from sexual intercourse, they will become, the disease is going to, they are going to share that particular disease, and it's important that they are aware of the risks that they are getting into in this particular situation. All right, so the next thing we're going to be talking about, and at this point, before we move on in the presentation, I just want to say that Deso Medical Center is actually here to provide quality medical services, both digitally and on-site, for all our clients. We are carrying out this series of education to the general public just to let them know of important things that they should be aware of. And as we do this, we also encourage people to be aware of these things, and to be also aware that they are also important in life. As I said earlier, this session is not sponsored by any institution except Deso Medical itself. So we have nothing to declare throughout the course of this presentation. So moving on, another important concept we're going to discuss today when it comes to premarital screening is blood group systems. Now, blood group systems are, almost most of the population, they are aware of their blood group and their resource status. However, when a couple, an intending couple, are getting married, it's important that they are also aware of why it is important that their blood group is known to them. Now, this is peculiar, especially to people who are resource negative. Now, when a resource negative woman, and this is the point where we should pay close attention to this presentation. In marriage, when a resource negative woman is pregnant, and let's say the spouse of that particular woman is resource positive, there is also a 50% chance that the baby being carried by that woman is going to be resource positive. Now, resource negative women carrying resource positive children have a potential risk to that particular baby and the subsequent babies that woman is going to carry. Now, this can be managed in itself. This condition where resource negative mothers carry resource positive babies, it can be medically efficiently managed. However, it is important that the couple is aware of this, so that by the time they are presenting their medical history to wherever they are getting care, the caregivers would be aware and factor this into the management of such pregnancy. Now, blood group system is a routine test when it comes to antenatal clinics, but it's important that the couple also are aware of this as they get into marriage, because the consequence of mismanagement or of marriages that are pregnancies that are not properly managed, when a negative mother carries a resource positive baby, can actually be catastrophic to subsequent babies that woman is going to carry. So these are important things that we should be aware of for intending couples. Now, the last point on this particular slide is titled others. Now, others primarily because this list cannot actually be completely exhausted. However, it's important that we mention some other diseases that are potentially inherited from parents to offspring, and also that would affect the quality of the life of the couple. Now, we've heard, there are many stories, there are many cancer stories that we've heard, but one popular cancer story was the story of a popular Hollywood actress whose grandmother died of breast cancer, whose mother also died of breast cancer, and finally, who was also diagnosed at an early stage with breast cancer. Now, we know that there are certain kinds of cancers that are actually inherited from parents to offspring. It's important that as a couple, when getting married, some level of medical history be ascertained from our parents on both sides. So if there have been histories of diseases such as hypertension, such as diabetes, especially in our environment now, hypertension, such as diabetes mellitus, such as asthma, it's important that these conditions be made known to both couples so that when things arise in the future, they can know what course of action to take. Now, hypertension and diabetes are now we know with the medical information that we have is that it is partly actually inherited. Hypertension and diabetes is partly inherited from parents to offspring. So both couples, if they have family history of hypertension or diabetes, for example, are in themselves at risk of these conditions. And when they know this, they can begin to apply proper what we call lifestyle modification such that they can have an appreciable quality of life. And in the same way, a disease such as asthma and as I mentioned earlier, family history of certain types of cancers. Now, I'm going to mention a particular point of note at this point. Now, there are the philosophical associations as well as religious institutions. None of them, and even legally, your spouses don't owe you children in marriage. They don't owe you that the marriage would have children. There is no guarantee. You cannot hold them to guarantee you that. However, if a man or a woman who are intending to be couples, if either of them have carried out any procedures that would tamper with their reproductive abilities, it is important that this be made known to both of them. So if a woman, for example, has had procedures such as hysterectomies, salpingectomies, or any other form of oophorectomy that will tamper with our reproductive abilities, it is important that the couple is aware. Also, in likewise manner, if the man has had procedures such as vasectomies or any other permanent contraceptive methods, it is important that the couple expose this to themselves before the marriage is contracted. Now, we'll move on at this point to the next part of our discussion. Okay, so where do we get tested? Before I tell you about where we'll get tested, I'll share a story, and this is actually a real story that was shared to me by one of my colleagues. So she's a medical doctor practicing here in Nigeria, and while she was doing her premarital test, she went to a laboratory where she ascertained her hemoglobin genotype. The test was confirmed that she was a hemoglobin genotype AA. Now, her spouse was a carrier of the sickle cell trait. So the spouse's hemoglobin genotype was AS. So happy that she's AA, she knew that she could get married to this man without any possibility of them actually having sickle cell, of them having children that will be sufferers of the sickle cell anemia or sickle cell disease. So when she got married, she had her first child, and then 6 months after, when the child was just teething and beginning to grow, the child got severely sick. When she went to the hospital, they did a series of tests, and they discovered that the child's genotype is actually SS. And she was really concerned. How could this have happened to her when she had medical tests that said she was genotype AA, certified from the laboratory? Eventually, she had to retest herself severally, and then it was confirmed that her genotype is actually AC. And we know that SC children are also sufferers of the sickle cell disease. The point I'm trying to give from this story is the fact that it's important that wherever you go for your test is a certified laboratory where standard procedures will be carried out to confirm your genotype, as well as the genotype of your spouse before the marriage is contracted. Well, the lady in question had to bear the burden of this medical mistake. So it's important that you go to a certified lab for this test to be carried out. In fact, some marital institutions will not accept results except they are carried out at particular institutions, medical institutions, where they can rely upon the result. So it is important, and this is important because marriage is such a personal and such a private endeavor that every precautionary measure that you can take to preserve the quality of your marriage should be carried out by the couple. However, we also know that there are people who would go as far as forging results to contract marriages with certain people just because of perceived advantages. So it's important that the couple go to a laboratory together that is certified and that is reliable to get their test. In fact, repeated testing is not discouraged in this particular situation. So at this point, I will just try to recap what we've discussed so far, and then we'll also open the floor for questions and interactions as regards premarital tests. Now, we started by saying premarital tests help to inform couples about their compatibility medically, and the reasons why it is so important to carry out this test is because of the disease burden, as well as the effect it has on the quality of the life of the individuals involved, of their children, and the strain it puts upon the marriages. We further went to discuss that in our environment, in the Nigerian society in particular, our demographics show that we are actually, for example, we have the highest burden of sickle cell disease as well as sickle cell traits in our society. So it becomes extremely important that we take premarital tests to be as important as they actually are. We also went further to say wherever you are carrying out your tests, be them the viral screenings, be them the hemoglobin genotype, as well as other medical tests we carry out before, which we discussed earlier, that the labs that we go to be certified as well as be reliable, such that we can, take the steps of marriage with more confidence. So thank you. I want to thank everybody for sharing their time with us this afternoon to discuss this crucial topic. The floor is actually very, very open at this point for question and answers. And as also just still in light of the same discussion, Deso Medical Center has a standard laboratory that provides a range of tests, as well as home care services, and a range of other tests which I'll be mentioning as time goes on. But we have laboratory services, clinical services here. We render home care service. We also render telemedicine services, and we're going to show you some of these things during the course of this discussion. So we're going to give some time now for questions, for